Thoracic outlet syndrome. What is thoracic outlet syndrome? Thoracic outlet syndrome (TOS) is a condition characterized by compression or irritation of the nerves, blood vessels, or both in the thoracic outlet, which is the space between the collarbone, clavicle, and the first rib. This can result in various symptoms, including pain, numbness, tingling, weakness, and swelling in the neck, shoulder, arm, or hand. Anatomy: presence of cervical or anomalous first rib, clavicular callus or malunion, shoulder droop, large transverse process, C7 tumor. Etiology: TOS can be caused by various factors, such as anatomical abnormalities, trauma, repetitive movements, poor posture, muscle imbalances. Thoracic outlet syndrome clinical features: ipsilateral upper extremity and neck pain, swelling, and paresthesias, C8 dematum, with particular positions and activities. Preferred pain to the ipsilateral breast or chest may also be noted. Paresis, pallor, and cold in arm and hand with subclavian artery compression. Weakness of hypothenar and interosseous muscles, and hypesthesia in the region of the ulnar nerve, C8, T1. Thoracic outlet syndrome examination. Physical examination. Chronic loss of pinprick and light touch along C8-T1 dermatomes. Ulnar sensory changes. Median nerve motor deficit. Ischemia of digits. X-ray. Cervical thoracic spine to detect anomalous ribs. Thoracic outlet syndrome test. 1. Accents test. The patient is asked to rotate their head toward the affected side while the examiner simultaneously checks the radial pulse. If the pulse disappears or diminishes, it may indicate TOS. 2. Cruise test. The patient is asked to hold their arms out to the side and flex their elbows at a 90-degree angle. They are then instructed to open and close their hands for 3 minutes. If they experience weakness, numbness, or tingling in the affected arm, it may indicate TOS. 3. Wright's test. The patient's arm is abducted to 90 degrees, externally rotated, and extended backward. If this position reproduces symptoms such as pain, numbness, or tingling, it may indicate TOS. 4. Costoclavicular maneuver. The patient's shoulders are depressed and retracted while they take a deep breath and hold it. If this maneuver reproduces symptoms, it may indicate TOS. Differential diagnosis of thoracic outlet syndrome. Quadrilateral space syndrome. Posterior humeral circumflex artery occlusion. Axillary vein thrombosis, effort thrombosis. Peripheral nerve lesions. Suprascapular nerve, traction or compression injury, supraganglionic cyst from labral tear. Long thoracic nerve injury, scapular whinging. Axillary nerve injury, shoulder instability, surgical injury. Complication: nerve damage, muscle atrophy, vascular complications, chronic pain, limited range of motion. Thoracic outlet syndrome treatment. Conservative treatment. Patients should avoid positions or activities that precipitate the symptoms. Initiate physical therapy to increase shoulder girdle and neck muscular tone for patients with hypotonia. Posture exercises. Advise patients to avoid sleeping with arms in an elevated position or folded under the pillow. Surgical treatment. Aneurysm, resect, bypass graft. Cervical rib resection. Decompression of scalene muscle or pectoralis minor if compression. Some common exercises for toss may include 1. Scapular retraction, 2. Pectoral stretch, 3. Shoulder rolls, 4. Neck stretch. Prevention. Avoid overhead activity. Maintain proper posture. Do strengthening, flexibility exercises for shoulder girdle muscles. American professional baseball pitcher, Matt Harvey. He was diagnosed with the condition in 2016.